But before we get into treatments, guys, I want to talk about the gut-skin axis. That's a huge issue when it comes to inflammatory conditions such as acne, rosacea, which brings me to the point, actually, how is acne and rosacea different? Because a lot of times people get them confused. They think they have acne, but they actually have rosacea. Well, acne really starts as a clogged pore. That is the very first sign of formation in acne lesions. So you may see blackheads, you may see, closed comedones, open comedones, which you never see in rosacea. Although the skin can be red in acne, like just from inflammation. With rosacea, you have this baseline redness, and then you get this flushing symptom. And it goes beyond just inflammatory. It has to do more with the vasomotor response of the broken capillaries and the little vessels on the surface of the skin. People with rosacea also tend to develop this condition later in life. So it's something that we start to see in late 20s, early 30s, whereas with acne, we start to see that very early on, like in the teenage years, as young as 12 or 13. Rosacea is seen mostly in adults, younger adults is when it starts, and then again, it's a chronic condition, meaning there's no cure for it, but we have to manage the disease and the symptoms to allow it not to progress so rapidly. Another major difference is the ocular symptoms. We never see, redness, itchiness associated with acne. We often see it with rosacea. We often see acne anywhere and everywhere on the face, whereas with rosacea, it's mostly the nose and the cheeks. Sometimes we see it on the chin, in the glabella area, but mostly it's confined to the central face, whereas acne can really be anywhere, including off the face and on the body, such as the back, the chest area, shoulders. Now, acne is mostly controlled by your hormones. Yes, they both share the disrupted or weakened skin barrier, but with rosacea, genetics plays a role, and it tends to be chronic inflammation. So if you have it, you're going to have it sort of lifelong. With acne, it's really very much tied in with hormonal influences, and you'll almost never see a rosacea patient with blackheads, meaning the open comedones, the clogged pores, which oftentimes you will always see with somebody who has acne.